Satisfy your need for happiness through your own curiosity with The Ranveer Show. The most common problem you hear about is anxiety. Now, I remember being 13 or 14 without social media. And then I remember social media coming in, changing the way you thought. The thing is, the teenagers of today have grown up in a world that's fueled by social media. Anxiety is much more common. We see suicide rates going up all over the world. Something has gone wrong with society, and I feel bad for this generation as well. Now, we put forward that base level statement of don't self-diagnose, go to a psychiatrist, go to a psychologist. But sir, as a psychiatrist, what do you look for to confirm whether someone has anxiety?
See, as of now, you're looking at most mental illnesses as clinical diagnosis, right? So, which would mean that when you'll talk to me, you'll tell me what you're experiencing. I'll look at the symptoms. I'll probably ask you some questions to understand what your symptoms are. I'll try and understand the duration, and I'll try and understand the impact on your life. These are two things which are very important.
Duration and impact on your life.
Okay. So duration can't be just yesterday or today. And it can't be once a year for 15 minutes. It has to have an impact.
2 weeks is your number usually?
At least when it comes to depression. I mean, different illnesses will be different.
Sure.
Right? The other part, when you mentioned also about the... So WHO 2022 report very clearly says that there is a 25% increase in depression and anxiety post. So that's an established fact. Obviously, multiple factors, and we'll probably have another decade or two to understand what impact was biological, what was the psychosocial aspect. But as of now, where we stand, that is what it is. Now, anxiety by itself is a symptom. I am anxious. But anxiety disorders is a spectrum.
Okay. One level lower. Yes. What is anxiety?
Worry, apprehension, feeling that of something happening, a doom, a fear kind of a feeling, thought process.
Pre-exam feelings?
Yes.
That's anxiety?
Yes. And physiologically or in body experiencing certain things.
Short breath.
Yes.
And?
Palpitations, perspiration, maybe a bit of nausea, maybe a bit of tremulousness. Now, anxiety disorders, it could be a panic disorder, which means I have repeated panic attacks.
What is a panic attack?
Sudden episode lasting for a few minutes where I feel that something's happening to me. These individuals end up visiting emergency, end up visiting cardiac doctors a lot more, because it feels as though you're having a cardiac or you are dying or something's happening to you. So they keep rushing there because they feel you can't breathe, something's happening, I'm having palpitations, I am feeling like choking happening. So these panic attacks happening. And you diagnose, people say there's nothing, but it becomes a pattern. Then you become scared. You don't feel like going out. You don't feel like meeting people. You are scared of what happens during the next episode or next attack happens, starts playing on your mind. So that's panic disorder. You also have phobias. For example, social phobia would be that I'm hesitant in, let's say, in a Viva exam. I'm absolutely fine in a written exam, but the moment I have to speak in front of an audience or a supervisor or an examiner, or as a working adult making a presentation or meeting clients, that's where I start struggling. So I have the same panicky symptoms in that situation.
Okay, small rewind. What is the feeling-based difference between a heart attack and a panic attack?
So try and understand like this. For me to say how would you know what is an impending heart attack or what are symptoms, not my specialty, shouldn't even say that. But what I can tell you is how a panic attack feels. Sure. Panic attack feels, so it's like a inverted U graph. Okay? So you feel something building up, gradually increasing. You may have variety of symptoms, from headache to dizziness, to giddiness, to breathlessness, dry mouth, watery eyes, sense of choking, dry tongue, palpitations, butterfly in the chest, tremulousness, frequently wanting to go to urinate, feeling you can't be steady on your feet, feeling that something's happening to me, something will happen to me, am I dying? Those kind of experiences an individual has, peaks about 15, 45 odd minutes plus minus, and gradually starts going. Now, because I don't know why it happened, because I've not been aware that this could be an illness by itself, a well-defined illness with an easy treatment, I feel, oh God, what's happening to me? The moment I feel what's happening to me, I obviously start seeking help. So I go through checkups, but those checkups are not checking for where the problem is. So obviously, I'll probably come clean in my blood profile, I'll come clean in my cardiac profile, so on and so forth. And yet that episode comes. So now I start fearing that when will the next episode happen? Where would it happen? Sometimes I correlate places. Sometimes I correlate situations. Sometimes I correlate something else. That correlation becomes another pattern of anxiety for me, which is where a psychologist will tell you to disconnect. These two are not related. You are relating them. Go ahead and gradually face it.
Like, for example?
For example, let's say you got a panic attack when you were about to board a flight. Now you're anticipating the next time you're about to board a flight. Then that anticipation becomes so much that one day prior to boarding the flight, you're probably not able to sleep too well. Then a couple of days before you start worrying about it, then you start avoiding these flights as much as you can. And then it starts affecting your work because flight was probably an important aspect of your work.
What's the medical treatment here?
So biopsychosocial, you look at medications for anxiety disorders. You will also look at cognitive behavioral therapy, some other forms of psychotherapy, which is your counseling and which is done by
you're trying
psychologists.
to shift thinking patterns.
Yes.
In cognitive therapy.
Yes, in cognition. So for example, something bad always happens to me. So the correction would be always is not possible. When bad happens, good also happens. Why don't you start filtering the good and the bad, and you'll stop seeing it as all or none or a generalization or a maximizing, minimizing, and so on and so forth. And then you bring some changes in your lifestyle. For example, if let's say how much caffeine you take, have you noticed that maybe caffeine intake increases your anxiety, right? Or let's say substance use. Have you noticed that when you take certain substances, you have more anxiety happening? I mean, there is evidence that let's say people who would use alcohol more regularly statistically have a more correlation with depression and anxiety as an illness, whereas people telling each other in in social gatherings would be that I feel relaxed when I drink. You may feel relaxed when you drink at that moment, but if you are a regular user, then you are also more prone into having anxiety and depression as an illness.
Like you pay a price for that feeling of chill.
Yes.
That's the truth about intoxication. And I've gone through multiple phases of intoxication in my college life and a little bit after college life. I've been a teetotaler for a long time now. And this is the nicest I've felt in my life. But I remember what intoxication felt like. It felt great while you're intoxicated, but you'd pay a price. That's what people don't understand.
You pay a huge price. You will not be able to find a longitudinal axis of success if you're on substances. Anybody who tells you otherwise is absolute nonsense.
If you enjoyed today's clip, make sure you check out these curated playlists that we've made especially for you related to the subject that was spoken about in this clip.